Hi friends, so this is your friend Arun from Live in Germany channel. So today I'm back again with another interesting topic, an important topic, the price increase in public health insurance coming in the year 2023. So this will be useful for anybody who is living in Germany and publicly insured, and especially if you are earning more than 5,000 euros and you are publicly insured, you will have a little bit more than what it is currently. I will tell that with an example. So, or you just have interest in knowing how this works in general, please do watch the video till the end. I will try to explain mostly in English much as possible. So before I jump in, if you are somebody who is interested to know about private health insurance and also how you can save money, I have made a video recently in the past. You can either watch the video or book an appointment to understand it on your case, whether it is beneficial or not. Now to the video. Hi guys, so now to the content. So this particular rule or law is done every year in order to see if they have to make changes to the social contributions. It is called as Sozialversicherungsrechengröße in German 2023. So based on this, there is going to be an increase in the public health insurance. So this rule or law is applicable and has changes also in pension insurance and other stuff as well. But this video will be covering only health, because when I try to make the whole video, it was more than 25 minutes, so I just try to make now for the health insurance part. If many people are interested, please do put in comment. I'll try to at least make a very small shorts or an example with that. So back again, so how this and why this happens. So why it happens is, like, the key reason what they say is development in income. So because there has been an income development in year 2021, they have to adjust the social contribution parameters for the year 2023. So they have assumed a value around 3%, and this is a basis. And also an important point which we are actually seeing, we have to see, is the deficit of funds. So although public health insurance has been going on very strong, there has been a huge deficit of funds, almost 17 billion euros or more as per the articles we have. So all the values which I mentioned here, I have put the references in description, also from official website. So please do have a read on it if you have any doubts as well. So just to mention that. So what is this changes around? I'll go one by one how they have made it. So first, they have increased the Jahresarbeitsentgeltgrenze. So what is this long term around? So for somebody to move to a private health insurance, they have set a limit. So normally for this year 2021, it is around 64,350 euros. So if you are earning more than this value as a total sum per year, you are actually voluntarily being in the public health insurance. For any reason, it maybe doesn't matter, but you are voluntarily in that. So this has been increased now to 66,600 from the year 2023. So how it impacts already who are there and already who's going to join jobs. So for example, in future, if somebody is going to join a job and their salary is not up to this level, they have to stay in the public, and only when you cross this value, you can go to a private health insurance and save some money based on your case. So this will ensure that there are more people in public insurance, and more higher earning people will put more money and try to balance out this deficit. So this is where I think most expats come to play. As Indians, we are having a little bit higher average incomes, and those in public and having 100,000, 200,000 euros maybe are actually paying for those who are earning less. So this is how this social security system works. It's good, but I'm just explaining the math thing. So the second thing which is also impacting everybody is the additional contribution increase. So before I go on to that, I'll just explain in short how this works. So 14.6% of your gross salary, or a particular value, German terminology, is based on how your health calculation or contribution is worked. So this 14.6 plus an additional Zusatz or additional contribution of 1.3% is 2022. From 2023 onwards, they are not touching the 14.6, but they are going to increase the 1.3 to 1.6%, which means there will be an increase of 0.3% to everybody who is publicly insured in general. So if you're a student, you will have an impact. If you're somebody who's working and paying for the whole family, you have an impact. If you're two people who are publicly, a couple working and then in public, you will also have an impact. So this is for all. So if you are already, if you're in this category and you got the information what you require, you can stop watching here. So, but if you're somebody who's earning more than 5,000, this is where it gets interesting and important to understand how silently you will be ending up paying more. So there is one word called as Beitragsbemessungsgrenze every year. So this value is like based on which this 14.6% and calculations are made basically, guys. So whether you earn 5,000 or whether you earn 6,000 or 8,000, 9,000 gross salary per month, this is the calculation value on which they calculate this is the amount or value on which they calculate the 14.6 plus 1.3 or 1.6 in future, and this is the value on which they also calculate the long-term care insurance, which I'll see in detail. So I will give an example for those who are earning more than this value, especially say in our example is for a 5,000 brutto salary per month for a single person who's there with no kids, or if it's a couple still not yet with kids, this will be applicable. So in the year 2022, based on online calculators and this percentage, it matches. So this value is 4837.50. So when you put 14.6% plus 1.3 and calculate for this number, you will get exactly how much you are paying for the health insurance contribution as it is in your salary slip. This is what I like because I like to play with numbers. And also likewise, when you calculate for long-term care insurance, you put this 4837.5 into 3.4%, you will also see the value. So definitely half of this on some amount is paid by the employer, but just to have an idea, this is how this calculation works basically. And currently we are paying around the summation I told you. In future in 2023, what happens is they have increased this 4837 to 4987.50 euros. So around 150 euros monthly they have increased. So indirectly, if you're already in salary more than 5,000 euros, you will be ending up paying more money. So how much is this more we're talking about? So as per my calculations, because I didn't find anything online, there could be little changes when official websites come up. So this is like a disclaimer, guys. This is purely mathematics on simple calculator. So when I calculated, you will be ending up paying instead of 384.58 around 403 euros 9875. So there is an increase in health insurance, and also in long-term care insurance, instead of 90.7, you will be paying around 93.515 and some blah blah blah. So what this means is you will have an increase of at least 23 to 25 euros per month from your pocket itself in netto. What you will be, you have to be paying out extra from your pocket. So over a year, this is around almost more than 200 euros. So if you have a chance to move to adjust this by some means, or move to private, or you have to change your financial planning also, please do have a look at it. I just want to give this example, nothing to scare you guys, because a lot of people want to know how this works. So this is how this works basically. So the same changes are also happening, for example, in pension as well for very high earning people. So this I will make probably if more people are interested. I hope this was clear to some level. So if you are having a child, for example, maybe this long-term care insurance will be little bit less, less by 0.35%, but otherwise most likely you will be ending up paying this value if you are publicly insured and having more than 5,000 euros of gross salary. I hope this was nice, guys. So thanks for watching this video till this end if you're still here, and I hope I'll come back again with another video, and thank you and bye bye.